Kenneth Cherry and Dr. Jimmy Yao. It's May 31st, 2013. And for the history project of the SVS, we're interviewing Dr. Jose Fernandes Fernandes from Portugal. Dr. Fernandes, I just have to ask, how did you come to have the name Fernandes and Fernandes?
Well, it was a coincidence. My father, his last name was Fernandes. He met my mother when he was a student in Coimbra. My mother's last name was also Fernandes, so they married, and they put and my name came as Fernandes and Fernandes. But I was a bit ashamed of that. It was too long, and I used just Joseph Fernandes. And one day, many years ago, I was a young resident. I remember I was giving a lift to Professor John C. dos Santos. He was waiting for a taxi, and I was driving my car and asked him, "Do you want me to take you somewhere?" And he said, "Yes, all right, take me to my office." And he asked my name. And I said, Joseph Fernandes, Fernandes. And he said to me, "Well, my son, you should use your name, Fernandes as a professional name. Fernandes, there are many Fernandes in this country. Fernandes will be you." So that's the way I did, and I changed. I started signing my name, Joseph Fernandes.
So that was Dr. Cid dos Santos?
John C. dos Santos, yes.
Now, the Ray dos Santos and Dr. Cid dos Santos obviously had a huge influence on the history of vascular disease and vascular surgery, not only in Portugal, but in this country, and especially in San Francisco with Dr. Wiley. Have they continued to have a big influence or legacy in Portugal?
Oh, yes. Reinaldo dos Santos was the father. He was the introducer of translumbar aortography. And his son, John C. dos Santos, introduced phlebography, as you know, in 1936, and then endarterectomy. And I was very fortunate because I was his youngest resident and the youngest assistant. And he had a tremendous influence on my career. He was the chairman of the Department of Surgery. I worked in his department, and I wanted to do vascular surgery. When I started my surgical residency, I was geared to do vascular surgery. But the professor was a bit distant man, and he never knew about the young residents. And one day, there was a woman that came into the emergency department. I was on call, part of the surgical team. And there was a rule. She had a severe ischemia. And there was a rule. You call the professor. If the professor can't come, someone else will come. Actually, he couldn't come. The second guy on call couldn't come. I was out of Lisbon. But he was the man who was my teacher. And he asked, "Could you do the operation?" I was a very young resident. And I said, "Yes, I can." And I did the operation. It went very successfully. And the following morning, John C. dos Santos always did a round. Every early morning, he would do a round through the operated patients. And I explained what I have done. He moved away and suddenly turned his back and said in a loud voice, "The boy did well." So he noticed me. I knew that I became noticed by him, and he was a great influence on my career. He really helped me a lot and promoted my going to London, where it was the next step of my career. I went to London to work with Felix Eastcott at St. Mary's Hospital. And that, again, it was, I don't know if I can tell you this story. It was an interesting story.
That's what this is about, interesting stories.
I was on call. I was on the emergency department, and the patient came with an arterial embolism, very short-living embolism, about an hour before it started. And I gave him a shot of heparin. This guy was a big shot. He was a big personality. And I sorted out the problem. It resolved. He needed a heart operation. He went to England and invited me to go with him. And I went to see dos Santos and said, I got this invitation to go to England, but I would like to visit some vascular departments. Could you write me an introductory letter? He wrote the letter to Felix Scott, and I also went to visit the Westminster Hospital. Felix was very nice to me, and he took me to see him operating. Interestingly, we had an interesting conversation about literature. Dostoevsky, I remember that. And I liked him, I liked the surgery, and he liked me apparently. And I asked at the end of the procedure, can I come and work with you? And he said yes, provided Professor Dos Santos writes a recommendation letter. I got the letter, and the following year I was in London, and I worked at St. Mary's for 3 years, combining the clinical work at the hospital with the research at the blood flow lab at that time. You remember that?
Certainly.
The blood flow lab. You left in 1972, I arrived in 1975. Lots of people were talking about you and your work, and it was quite an experience, and I stayed there for 3 years.
Was your father or mother a doctor?
My father was a doctor.
And what type of doctor was he?
He was a general practitioner, and he had a tremendous influence on me. I always wanted to become a doctor. I had it very clear in my mind. And I got from my father an important lesson for the medical profession, that's to put the interests of patients in the first line. It was his main concern was the patients, and he was a man of high ethics, of high commitment to the patients and to the profession, and he tried very hard to pass it on me. And I had also an uncle who was a surgeon. He's a surgeon, still alive. He's 94, and I fixed his aortic aneurysm some time ago. But he's...
How did you fix his aneurysm?
It's about a year ago. It was...
Endovascularly?
Endovascularly, yes. And he did well. He did very well. But my uncle was a surgeon at the time, and he used to teach me surgery. And I witnessed my first appendectomy. I was 9, at the age of 9. They put me in the operative theater. I enjoyed it very much. And then he helped me in the local hospital. I was doing my residence in Lisbon, but I would do some minor procedures in my hometown. My parents lived about 100 miles northeastern of Lisbon.
What town was that?
Ponte de Sor. It's a small town northeastern of Lisbon. And there was a local hospital that I used to do hernias, hydrocele, phimosis, helped by my uncle. My father never wanted to assist me, but anyhow, I learned a lot, and my uncle had also a great influence on me.
And you mentioned earlier that you knew you wanted to be a vascular surgeon. At what point did you know that vascular surgery was the specialty you wanted?
It was, I think, the transition from the general internship to the residency program. I did that in Lisbon at University Hospital. And I went, during my general internship, I went to the surgical period, and the surgical period was on John C. Dos Santos department, and I liked it very much. And I was involved on that. I worked with a person who was very much involved with angiography, and I enjoyed angiography. At that time, we performed angiography. Angiography was performed by the vascular surgeons, and I was able to start doing a few ones, assisting first, and then starting doing them. And I really thought, well, that's what I want to do. I want to do vascular surgery. And it was interesting because at that time, we acquired a huge experience on angiography. I did arteriography, phlebography, all techniques, ascending and descending phlebography, even lymphographies, which were extremely useful for me when there was this shift from open surgery to endovascular techniques. It was not difficult for me because I have been trained to do that.
You got back on your bicycle.
Yes, that's true.
Yeah.
That's true.
When did Dr. Dos Santos die?
Dr. Dos Santos died in 1975. I was already in London, and I remember I got the news of his death. I was already in London, working in London.
Would I be right in assuming that because of the Dos Santos family, that vascular surgery is venerated in Portugal?
Well, it's well regarded, very
Yes.
well regarded, yes. John C. Dos Santos and his father were extraordinary personalities, not only on the medical side of life. They were men, both father and son were men of culture. They used to be called Renaissance men because their interests were vast. Ronaldo had an extraordinary book on 8 centuries of art in Portugal, which is really a Bible. If you want to study Portuguese art, you have to go through his book. His son was a man, an extraordinary personality. He captivated. He was really brilliant to talk with him. And you always learned something talking with him. It was really an inspiration for me.
When the endovascular era came to Portugal, I'm assuming in the 1990s, as it did
Yeah.
pretty much worldwide, did your unit embrace it immediately, or?
No, no. There was like in other countries, like everywhere, there was some kind of reaction from the established vascular surgeons to the new techniques, which, by the way, in Portugal, the first angioplasty was performed by a radiologist. I think we were a bit slow to enter into this revolution, but I was fortunate because I had this training. I could started it, and I started in a way. I probably played a role in my country getting these procedures going within the vascular community. I started doing peripheral angioplasties, moved to visceral, renals, and all that. And I started in Portugal. I did the first EVAR, and the first TVAR in my country was done by our team.
This is a little bit of a change of topic. Has the European Union and the unification of the monetary systems had much impact on medical and surgical training in Portugal? I mean, can you be trained in Portugal and practice in Spain or practice in Denmark or?
Officially, yes. Officially, I think you are entitled to practice in all countries of the European Union. In practice, you probably won't get the best jobs. You have to go through a process of selection. When I went to England, I had to submit my CV and to do an English test and to be judged by the General Medical Council, I think it's the name, and to make sure that I was fit to practice and to work there. Now you can go. You don't have those limitations. I was very much involved in a few years in the 80s with the beginning of the European Society of Vascular Surgery. Actually, there are some interesting pictures of people involved in that group that started the SVS. And the aim of the SVS was to promote science, vascular science, across Europe, and try to improve the standards and equalize, or try to move towards equalization of standards across the European countries. And the SVS played, I think, a very important role. Also, in Europe, we have a system, an association, which is a professional association based in Brussels, called European Union of Specialist Doctors, Union Européenne des Médecins Spécialistes. And that tries to establish guidelines for the training, even for recognition and exams. And at that the period of my life, I was involved with the establishment of that. And I was involved with the establishment of the European exam on vascular surgery. What gives you the accreditation is the national exam. With the national exam, you can practice. But having the European exam is probably an enhancement, a proof of quality. And you have now younger and younger generations, younger vascular surgeons having this exam.
In the United States, as you know, classically, a young man or young woman will go to college for 4 years and then go to medical school for 4 years, and then we have different models for training. The classic 5 years of general surgery, 2 of vascular. Now there's the 0 plus 5 where someone commits after med school to go into vascular surgery. What is the model for training in Portugal?
Well, when I started, we did general surgery. It was general surgery. And then we had a practice in vascular surgery, not a formal practice. I had my vascular training in London, so I had 3 years of vascular training in London. The situation moved, and moved towards a way that sometimes I have some doubts about it, because suddenly people lost the training, the education in surgery. And they made the option too soon in their career for a specialty. And I had the impression that was not the best system. I wrote about that. I tried to involve in a discussion in my country that we should probably maintain a surgical, a general, broad, basic surgical education. Finally, and then with that, it would be easier to do vascular surgery. We would not need so many years to do vascular surgery. And somehow we would preserve a unification of surgery. You know the book from Wangenstein, The Rise of Surgery, and he defends the unification, surgery as a unified body. And I think that's important. But I lost that. The training now is unfortunately 1 year surgery, 1 year rotation through different specialties, of course, intensive care units, intensive care medicine, and so forth. And then you have 4 years of vascular training, formal vascular training. And that includes also training in endovascular techniques.
Now, in this country, we have an 80-hour work restriction for our residents. Are there work work restrictions in Portugal for your residents?
Yes. We follow the European directive for 40 hours. And the tradition is that the residents officially can't do more than that. It's different. I used to do many more hours than the established 40 hours. Everybody did that. And I think the ones that really want to go forward in their profession, they can't be limited by these hours. Although I'm perfectly aware, and that this is an important issue of safety, patient safety. You probably won't perform as well as you should do if you are very tired. But it's an endurable.
But it's hard to imagine for older people like myself that we can train people adequately 48 hours.
Yes, I agree with you. If I have to do an operation out of the official hours, and if I call my assistants to come, I'm very upset if someone says no. They never said no to me.
Yeah, welcome to the interview program.
Thank you.
I remember you well. We met in Portugal, London, And many
Chicago.
times. Chicago, that's right. Are you having a good time at St. Mary?
Oh, I had a fantastic time at St. Mary's. It was really an education, professional education. Living in England was also a civic education. It was really, and the opportunities in London were great. I got married in London. My wife is Portuguese. She's a doctor as well. But we got married when I was in London. My son was born in London. My eldest son was born in London. So I have very good memories of London.
You work for Felix.
Yes,
Iskak.
Felix
How
Iskak.
what's your experience with him?
Oh, he was a fascinating man. An excellent surgeon, a very good surgeon. I learned my craft, the art and craft of vascular surgery with him, I must say. And he trusted the people he trained. And I remember the first time I had to do a ruptured aortic aneurysm, and I called on him and said, there is this patient with a ruptured aneurysm. Do you want to come and do it? And said, no, tell me what you plan to do. And I said, I told him, and the only thing he said to me, when you finished, give me a ring. And I rang him, said, okay, patient is alive, and it's okay. And he said to me, well, you did your job. I hope the patient survive. And he helped me a lot. He really had a great interest and supported me a lot.
Yeah, I spent 3 years at St. Mary, but I was attached to the surgical unit.
Oh, yes.
And the professor and Felix, they don't get along.
No.
So Felix never, I say good morning to Felix, he didn't even look at me.
That's what, who was the professor at your time?
Professor W.T. Irvine.
Irvine, yes. Well, Irvine left. You know the story.
Yeah,
He
I know
left.
the story, yeah.
And it was Dudley. On
Yeah.
my,
I know Dudley
Hugh
too, yeah.
Dudley. Dudley was a very difficult man. I didn't go along very well with him. But Felix had the unit in control. He controlled the unit. And it was an interesting situation. He was very, he wanted us to do research work at the blood flow lab, which was at that time, John Hobbs established the blood flow lab, you remember him.
Sure.
And then it was Andy Nicolaides who was the chief of the lab.
It was an interesting time for me in London to see the fight between the surgical unit and Felix.
Yeah, the blood flow lab was part of the surgical unit, you remember that?
Oh yeah,
It was part of the surgical unit.
and Felix was the editor for British Journal of Surgery. I submit my paper in there. And one day I went into him on the hallway. He said, I like your paper. And then, boom, the paper is in print.
A seminal paper then. Yeah.
How many children do you and your wife have?
We have 2 children. The older one is a vascular surgeon too. He just completed he passed his European exam last March. My daughter is a pediatrician.
You all have been good role models then.
Well, yeah, we tend to believe that because I owe a lot to my wife. My wife gave up her professional career as a hospital doctor, and because someone had to look after the family, and she did that fantastically well. And I owe her the unity of the family, and the way he kept us together. And I think so. We tend to believe that. My son married with a doctor as well. She's an ophthalmologist, but an eye surgeon. But my daughter told us it's enough doctors in the family. And she married a guy who is a professor of robotics, an engineer and he's professor of robotics at University in Lisbon.
Will your son practice with you, or will he be in a different practice?
Oh, he's trying to move his own way, but he
Yeah.
assists me and he works with me as well.
In your spare time, and it doesn't sound like you have much, but in your spare time, what do you like to do?
I read. I read a lot. And I listen to music.
What type of books do you like to read?
Oh, I used to read novels. My mother was a teacher of English and German, and she was very much interested in literature, and she developed in me the habit of reading and of enjoying books. And my father never gave me much money, but he always opened an account in the bookshops, and I could buy the books I wanted, but not pocket money. And I read. I think I've read a fair amount of books, classical. I had a classical education, and now I'm very much interested in some of the ethical and social aspects of the professions of our society, and the trends that really seem to compromise the values that we were raised upon, and that worries me a lot.
What type of music?
I listen to classic music. I used to operate with classic music, but my team said that's enough. You have to change the music and change the.
You and I had the same thing. I used to listen to water music all the time, and I had a former Navy SEAL as a tech, and he liked heavy metal. And I said, when I get buried and they play water music, would you come? He goes, to hear it one last time.
Well, once in a while I can pass and then I can make them listen to some of.
And Dr.
opera
Dos
areas.
Santos was a musician, was he not?
He was a pianist.
Yes.
He used to play piano.
Yeah, and quite well, didn't he?
Well, I never heard. The story goes that he was quite a professional.
Yeah.
There was I had another professor, and actually a man who really had a great influence on me. When I came back from London, John C. Dos Santos was dead. I was a bit alone in the field, in the academic field. And this, it was a professor of cardiac surgery and the chairman of the general surgical department. And I remember that in London I worked with a cardiac surgeon, Stuart Lennox from Brompton. He was going to do some coronary surgery at St. Mary's at that time, and I used to assist him. And he asked me, do you know this professor's cardiac surgery in Lisbon? I had been his student, I was a good student, but and he introduced me to him, and he took an interest in my career, and he helped me. It was Professor Celestino da Costa. He was a distinguished surgeon, a very interesting man, and he helped my academic career, because there was a period of my life where all the academia have problems. There were all sorts of problems. I had quite a few problems at that time. My private practice was thriving, and I wanted to come out from the academia, and this man just put me on the right track, and he convinced me that I should stay in the university. He was probably right, I don't know.
Well, Portugal is well known for a contribution to vascular surgery, the arteriogram, the translumbar, and the thromboaneuplorectomy. Tell us some story about how that happened, and you must know about it.
I know. The translumbar aortography, it's a fascinating story, because you know that the man who invented angiography was Egas Muniz. Muniz invented the cerebral arteriography, aimed to detect brain tumors by the shift on the vasculature of the brain. But then it was interesting. He was the first to describe the clinical correlation of an occluded internal carotid artery and a stroke. And there are some descriptions of successive transient ischemic attacks in patients with carotid disease.
I see.
This is not very often mentioned in the
No,
literature.
true,
It's
yeah.
attributed to Miller-Fisher, but I think one of the first descriptions belongs to Eges Muniz in a book entitled Thrombosis of the Internal Carotid Artery. That was written in the early 30s, and the arteriography was described in 1926 or 26. Then Reinaldo dos Santos, and this was written by Eges in his book, Reinaldo was listening to the presentation and asked him, do you think that this technique could be used in other areas of the body? And he said to him, why don't you try? It's your turn, and try it. And he tried it in the aorta. That is written in the Eges Muniz memories. And that was a brilliant period because they developed arteriography, phlebography, his son, John C. dos Santos, and also not only ascending, but the descending techniques. You remember that? And lymphography was described by another anatomist in Oporto, Hernani Monteiro. He described lymphography. But that was a very interesting period. John C. dos Santos discovered endarterectomy when he removed an old thrombus from an artery. It was a delayed embolectomy, if you wanted, delayed embolectomy. And when they examined the pathology, they saw there was part of the arterial wall. And he was that was really the touch of the genius. And he said, "This is something new." And then he went deliberately to do it in a femoral artery and succeed in a axillary artery and succeeded, and described the technique. And the technique lasted until now. We still do endarterectomies for the carotid, and once in a while for peripheral arteries.
What's your official status now?
Well, I'm a full professor of surgery.
Okay.
I'm the chairman of the Department of Vascular Surgery, and I've been for the last years, I've been the dean of the medical school.
The dean.
The dean. It was, I thought it was, I don't know how to say it in English, when you have someone who doesn't like you and offers you a present, something to it's a poison. I thought it was a poison. Someone was
Trojan horse.
a Trojan horse. Yeah, but well, I have been doing that for the last few years. It was an interesting experience. We changed the organization of the medical studies in Portugal. It was. I found, and I never could understand why the organization of the pre-graduation studies were the same at my time, from my time till now, adding new specialties, new disciplines. It was really incredible, and I thought it was a mistake, and I was decided to change it. And I asked an international committee to evaluate the teaching at the medical school. They didn't like it very much, but I succeeded in achieving that. And they suggested a few reforms, and we implemented the reforms. Now it's a completely different curriculum. I think it's more modern. It's more close to the one that is practiced in the best medical schools, and I feel very, very proud of
Well, the economy in Portugal are not as good as it used to be. That affects your Medicare and all the.
Yeah, the economic situation. Yeah, Europe is going through a difficult period. Portugal, it's one of the countries who is under a program of economics. I don't know how to say it. It's a support program. We are under financial administration from from a troika, from the IMF, the European Bank, and the European Commission. It's been difficult. It's been difficult for everybody, for people in general. The unemployment rate went up. Salaries came down. My salary at university came down 20%, 15 to 20%. But we will overcome this. We are an old nation, 8 centuries. This is not the first time in our history that we have problems, and we will overcome them.
In your career, Dr. Fernandes, what are you proudest of?
I had an interest. There was a professor of surgery that once told me, well, you know, I never think of the good things I did. I always think of the mistakes I made to avoid them. And I don't look very much what I have done, good things or whatever. I think about when things don't go well, and I really try to spend many moments trying to rewind all what went wrong and trying to avoid, in order to avoid in future situations. But I'm proud of I think I've contributed to the modernization of vascular surgery in my country. I think I did that. I introduced the vascular lab. In Portugal. There was no tradition of having a vascular laboratories, and I introduced that and organized the first vascular lab in the Lisbon area. I think I educated a few people. I was lucky in a way that I could embrace this endovascular revolution and be able to be part of that, and I think that was good.
How big is your surgical unit, the vascular surgery unit? How big is it?
We have about 36 beds. 36 beds. We have now access to do the complex endovascular aortic problems at imaging suite of the radiology department. We don't have a hybrid room. It's very expensive. Not yet. I'm pushing. I'm trying to the administration to consider that. And we have operative theaters. We have facilities to do routine angioplasties and on the operative theaters. And I also, we can combine private practice in Portugal. And I started a vascular institute and then cardiovascular institute. It's a group practice with cardiologists and cardiac surgeons. And we really started a dedicated room in a private hospital to endovascular work. And so I have in the private hospital my own endovascular suite to do that.
For vascular training, do you use simulator? How long is the requirement for training for become a vascular surgeon?
The official requirement is 4 years, 6 years. 6 years. 2 years. First year general surgical training. Second year is rotation. As I mentioned before, you go through intensive medicine, cardiac surgery, trauma. I can't remember some of the specialty. Then 4 years of formal vascular training. For that, we start having training programs for endovascular using workshops. Actually, one of my, you asked me about something that I would be proud of. I was proud to have started in my medical school the simulation program for the students and for training of residents. And we use this simulation for basic surgical techniques. Somehow we imported the program because I'm a fellow of the Royal College of Surgeons in England. We imported the program and adapted the program to Portugal. So we had that for basic skills. All residents in surgery do that. And we devised workshops, practical workshops. And it's a point that I think it's very important, combining open and endovascular techniques. I think the simulation is extremely useful for open, how to perform an anastomosis, how to perform a patch angioplasty, how to do a simulated aneurysm, carotid endarterectomy, and the varicose vein operation, and also with endovascular technique, how to go into the artery. I think it's the tip of its trick for success is to go there well, without dissection, without problems, and we have that station and then simulations that we use for different techniques.
Well, the Society for Vascular Surgery is very interested to develop international relationship. We have an international committee, and we have, membership category, a new one called international membership, and also have an international scholar program for young surgeons to come to America, attend the meeting. You have anyone in your institution you would encourage them to apply?
Yes. I think it's a great opportunity. It was a great opportunity for me to go at a young age to international meetings. I was very fortunate to have done that, and I would love to stimulate my residents and my young residents. I do that in Europe because it's easier, but it will be great to be part in to apply or to be part in a program and apply for they could come and participate in the programs.
Is there any other thing that you think we should talk about? To anything we should discuss?
In part of my life, I was very much associated with the development of the European Society of Vascular Surgery. And the European Society was really modeled upon the principles of the SVS at that time. I think the European Society is doing well. I was president of the European Society in 1996, 97. We had the meeting in Lisbon, 97. And that gave me the opportunity to have in Portugal many of my American colleagues and friends and mentors. I remember Professor Rich was there, Professor DeBakey was there. I invited DeBakey to go there, and we had a symposium to honor the 50th anniversary of endarterectomy, which was presided by DeBakey in the Eastcott. It was really a great occasion.
Well, Dos Santos is a very good friend of Jack Wiley.
Yes, and Ronald Stoney was there.
Yeah, Ronald Stoney has a story to tell. And Ken Cherry know about it too.
In fact, they celebrated the 50th anniversary of University of California, San Francisco program last night at a very nice dinner, and Dr. Stoney read from Dr. Dos Santos' homage to Wiley.
Oh, that was published in Portugal.
Yeah, and he read from it, and it has a definition of vascular surgery that to some people may seem facetious or or even capricious, but it's not. And he defined it as the surgery of ruins.
That's true. That's true, but we should not be demoralized by that.
No, no.
But in fact, our patients have the worst life expectancy of these old surgical patients, and but anyhow, and he also in that speech he promoted the concept of having the vascular department with angiography at the time, and we adopted that concept to have not only angiography, but the vascular laboratory should be part of the vascular unit.
And he read from that last night too. So
Did
we
he?
got to hear that. Yes.
Yes, it was an inspiring
Yes.
speech.
Finally, I'd like to know from you what you tell young surgeons when they start. What would be your advice?
Work hard. Learn as
Shut up and work hard, right?
learn as much as possible. Have an open mind, and be aware that the surgery that you're going to practice is not the surgery that you are learning. Change is important, but you have to understand change, and to understand change, you have to be prepared for it, and you have to learn and to be knowledgeable. So I encourage them to work very hard.
Well, I'd just like to thank you. It's been delightful. We've
Thank
learned
you.
a lot.
Thank you very much.
Thank you
Thank
for
you.
coming.